And self-harm and suicide risk among girls with ADHD. Why do you think that is, and what can we do to support our ADHD girls?
Yeah, it's quite a big question, but yeah, ADHD seems to contribute a bit
Yeah.
to suicide risk, and it might be through impulsivity, or it might be that some people with ADHD have, depression or conduct problems, like breaking rules of society. Those people with depression and conduct disorder have a higher risk of suicide and suicidal behaviours as well.
Right.
So there may be a couple of different mechanisms, or there may be some other things that contribute, kind of like less support. Sometimes people with ADHD have more difficulties making and sustaining friendships, and social support and support from families is a really good buffering thing in terms of those risks. In terms of what you can do about it, I think it is those things we talked a bit about before, kind of having a good assessment at the start and identifying other things that are going on that can be addressed or at least understood. And then I think kind of, building up strengths, things you're interested in, and friendships, positive friendships, and trying to maintain good relationships and things which we know are helpful. And then I think it's kind of, increasing awareness, so people are aware of some risks and kind of know what to do if they're identifying some signs that things aren't heading in the right direction. And health services are usually fairly good at responding to acute need. So if risk is getting quite high, there's usually an evaluation that's able to be done by GP or then mental health care. So I think kind of looking at getting help early on if things are heading in the wrong direction. Yeah, it's quite a tough one. And New Zealand doesn't do well from the suicide perspective. Rates are still pretty high.
Yeah.
They fluctuate a wee bit, and rates of self-harm are massive. And they had this survey in 2019 which looked at New Zealand rates, and in a year about 6% of teenagers take an overdose or do something to try and commit suicide or similar.
Wow.
It's
Yeah.
massive, like it's
Yeah.
an epidemic really.
Yeah. Yeah, it's a big one. Yeah, self-harm and the suicide. It's we've had personal experience within our family with that stuff, and one thing I did personally, which as a parent I found really helpful, was the ministry went to an online course called Life Keepers, and that was really helpful, because I think as a parent sometimes you have this sort of thought process that you have to be quite harsh about it. Don't talk about suicide, because I don't want to put the idea in their head,
Yeah.
Whereas I'd learned through that journey that actually just asking the direct question, is actually really important. And and I do wonder if part of the problem that New Zealand society has is the fact that we don't talk about it, and we do keep hush and we feel shame or embarrassment that we've had mental health issues or we've had these thoughts.
Yeah, still some stigma associated with it.
Yeah, there is.
Yeah.
So I think, more of that sort of thing is, what's needed.